All right, good evening, everybody. I'd like to call the February 12th Program and Budget meeting to order. And with that, I'll start by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. With that, we'll move on to item 3, adoption of the agenda. Motion from Megan, support from Selena. Any questions on the agenda? All right, seeing none, all in favor signify by saying aye. 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 All opposed? The agenda is adopted. Next is hearing of the public. Anybody from the public wishing to speak? Give us your name and address. You have 5 minutes, and you are on television. Going once, going twice. We will close public participation or hearing of the public. Next is item 5A, request to approve the out-of-state travel for Crossroads Clubhouse staff, Bruce Dunton, to attend the Crossroads Clubhouse International Accreditation in June 2020. The conference will be held at the Genesis Clubhouse in Worcester, Massachusetts for a Clubhouse Directors Seminar. This seminar focuses on the responsibilities that are external to the clubhouse and unique to the role of the director, such as branding, board relations, private and foundation fundraising, research, and building community partnerships. Longest agenda item ever. Motion from Ryan, support from Nick. Any questions on why he wants to go there? Did I explain it well enough? All right, seeing none. We have a motion and support. All in favor. Bruce, did you want to say anything?
Yeah, sure.
Cool. You're sitting back there. I figured why not.
Yeah, first of all, I just want to say thank you to the board for coming and visiting Crossroads. I hope that you had a wonderful time there. We, by far, have one of the top clubhouses in the state of Michigan right now, so we all should be very, very proud of that. The training in Worcester is just an opportunity for me to go and continue to develop some skills as a director of a clubhouse, utilizing the clubhouse model. With us experiencing our reaccreditation coming up in June, it's just a great opportunity for me to extend and expand some of those experiences as a director. Our expense for that will be next to nothing. I applied for and received grant dollars from BHDDA that will cover $2,000 of that training. In addition to that, we received another grant from MSU Extension that is also going to cover another portion of that. So, like I say, our expense to that will be next to nothing.
Perfect. Any questions, comments? All right. Kathy.
Thank you. Thank you, Bruce, for asking for this. I generally agree with any kind of additional training, additional information that our people can get, because what you end up doing is you end up making the program better, and all the people that you work with and serve, give them better service, and people learn from you too. So thank you.
Thank you.
Thank you. Anyone else? All right. Seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Thank you, Bruce. Next is item 5B, request to approve the Macomb County Community Mental Health Strategic Plan. I'll take a motion to approve.
So moved.
Motion from Shimatero, support from Plua. Is this Adam? Is this Dave? Is this somebody else?
I'll look to Cindy, but it's also part of the items C in, the annual work plan, C and D. Cindy, if you wanted to speak to all of it?
I can.
So they understand what a
Can you hit the button up
cooperative
there
is?
too? Thank you.
So basically, the strategic plan is what Dave and Adam have laid out as the map for where we want our services to go. The basic goals are to enhance the quality of service and effectiveness through improved consumer experience, improved health by increasing the provision of integrated care, to retain a competent, effective workforce and provider network, and effectively manage the network within the available resources. From the strategic plan, then we go into the quality assessment and performance improvement plan. So that basically speaks to the functions of executive staff, the things that, like the committee meetings, the organizational structure of the organization, and how our organization, as well as the board and the quality council, work toward ensuring that those goals take place. The following document is the work plan. So the work plan has goals and objectives. It's detailing exactly how we're going to get to the vision that Dave and Adam have spoken about. Any questions?
Nick?
Yes, Cindy, just couple of very quick ones. I noticed the quality assessment performance improvement programs this fiscal year.
Nick, can you put your microphone down?
Oh, I thought I did. Fiscal year 2019 and 2020, are those the fiscal years? The fiscal year ending 2019 is already over.
Yes.
Is this 2019? Are we going on?
It's from October 2019 through September
Gotcha.
2020.
That's what I thought it
Yeah.
was. And on the quality plan, it says it's the third arrow down, where we would be receiving periodic written reports of the activity of the QA/PIP. Realistically, what do you mean by periodic?
So we can begin to do it quarterly, and then there will be a final at the end of 2020. So I can bring you updates on a quarterly basis, if
So there'll be an
that's what you
annual
desire.
report, but we'll
Yes.
probably see something quarterly.
Yes, if that works.
Unless something else comes along. Okay, thank you.
Okay.
Any other questions or comments? Kathy?
Thank you. So besides a quarterly report, because I think that's new, I was going to ask, what is new or different about this strategic plan than other ones? Because that's often there are strategic plans that we have seen. Just wondering what improvements have been made to it or
So-
changes.
Basically, we are concentrating on the strategic plan this year and the improvement plan. Dave has split out some of the activities that came from the office. So now we can focus much more on the quality of the services and identifying exactly what executive staff is doing. So moving forward, if you desire, we can do that quality review and tell you exactly where we are with each one of those objectives, the interventions. In the past, there really wasn't the time to do it. So
That's a
that's
nice
one
way
of
of
the
putting it.
initiatives that we have moving forward, is we want to give much more information to the board.
Great, thank you. Because it also, in preparing to report to the board, it's also preparing to report to it's self-awareness of what's going on and report to the fellow employees of who's doing what and where we're at in the
Yes.
process. So thank you very much. And thank you to our director and our deputy director, everyone who's been working on this. Thank you.
Thank you, Nick.
Yeah, I was just saying, I was very impressed by all of this, and if the chair wants and the second agrees, and since we got the explanation of the 3 points, I'd amend my motion to approve B, C, and D. And just do it all in one vote unless somebody wants to separate those.
We can amend it to, B, C, and D. And who was this? Tony was the second. Is that okay, Tony? Yeah. Okay. So we have a motion to approve B, C, and D. Any other questions or comments before we vote? All right, seeing none. All in favor signify by saying aye. Aye. All opposed? Motion passes. Thank you very much.
Thank you.
Next is item 5E, approval of recruitment fee payment to locum tenens. I'll take a motion to approve. Motion from Kathy, support from Selena. Dave, did you want to speak to this at all? as you smirk.
I'll speak to it by asking Tracy to come to the microphone. She was responsible and worked very closely with locum. We did attempt some other creative options, which failed. But this is, I believe, a very reasonable solution and gets us moving forward for our chief medical officer.
We have been recruiting for 11 months for their chief medical officer. It has been posted the entire time on the Macomb County site and numerous other sites. We have interviewed and selected and offered 2 candidates, both denied it due to the salary associated with it. Just as a friendly reminder, the maximum salary for that position, and we've tried to work with county HR numerous times, but we're stuck at 161. So knowing that, I don't know how much you know guys about the industry, but there are postings out there right now for psychiatrists in hospitals, 300 plus. So we are very fortunate that we have Dr. Serpa, who is the candidate we are wanting to select, who's been acting as our interim for about 10 to 12 hours a week for the last several months. She has graciously accepted a counter offer where we will be doing an independent contractor agreement with her, which allows us a little more flexibility to pay a more competitive wage outside of that, and she will not be receiving benefits or paid time off or any of those other things that we could get through the county. She's been doing a fantastic job, and I'm sure Dave could and everyone could attest to that as the interim over the last several months. So we originally established a relationship through locum tenens with her. So she's been with us for a couple of years as a psychiatrist. Because of that, the originating relationship, we have to repay this recruitment fee per our contract. And I did provide in the attachments a copy of the contract if you want to see the actual language. And it's $40,000. We have negotiated where they're willing to let us spread it out over time a little bit, but it's still $40,000. So, and then if you notice in the justification, we also explained how we were counterbalancing this additional expense. There is a cost savings over time, and the way that it will cost us $40,000, but we're currently paying her as the interim $225 an hour. Once we negotiate, it's much less than that. So once we get past the expense of the $40,000 and the annual, it will be less than what we're currently paying out for that service.
Any questions? Selena?
When we do this with her, will she be staying on as the medical director at Common Ground?
Not to my understanding, no. She will be our full-time.
Our full-time?
She will be our full-time. She might still work with them, just to be clear.
Sure.
Right? But she will be our full-time chief medical officer or medical director.
Okay, thank you.
Kathy?
Thank you. This is just a statement. Nobody has to address this, but someone here needs to listen. So again, here's another position that's not on this pay schedule adopted by the county, or being used by the county. It's unrealistic for the needs that we have. So you don't have to dig in that one, but just want to make that statement. So.
Thank you, Kathy. And I was going to ask, because I know, well, I've been told when the study was done, they obviously compared it to similar positions across different entities, but they only grabbed, I think, half or so to compare. Do you know if this was one of those? I hate to ask you this because I should know this, but I haven't been told the answer to this. Do you know if this was one of those positions that was grabbed and compared to others in the industry outside of Macomb?
I don't want to misspeak, so I'm not sure if it was.
Okay.
I do know that, and I'm sure that they would attest to this, that they currently have alternative relationships for their chief medical officers and other departments for similar reasons. Like the medical examiner is not on the pay scale and does not have due to these things. So.
Thank you. Any other questions? Nick?
Okay, I thought I understood this before I walked in the door, and thanks to your detailed explanation, I'm now thoroughly confused. My understanding is we're paying Lucan basically a poaching fee, a prearranged poaching fee. But I'm not sure I understand what we're paying Dr. Serpa. I know what we're paying her for, but I don't know, are we paying her by the hour? Are we paying her a contractual amount? Is there going to be a contract? Does the contract have to be approved by the county? As all of our contracts do, with the possible exception of one, We're going to get that approval, which we've had trouble with in some other areas.
So we currently would have a independent contractor agreement with Dr. Serpa, which is a relationship that we have with other psychiatrists.
Sure.
So it would be in the similar manner. I did utilize that model, the independent contractor agreement, and went through county legal and had them looked at it because it's slightly different because it's a medical directorship. And they have edited it to correspond with that different role. So those particular agreements, although we go through legal, we don't go through board approval currently.
So we're not hiring her as an employee. We're hiring an independent contractor, and I'll leave that to my CPA friend over there as to whether or not that works, because we've gotten into trouble with that, or potentially trouble in other areas. But we're not signing a contract with her for any period of time. We're just paying her as an independent contractor on an hourly basis.
Yes, but it does have a time frame that gets renewed every year, and it has a 30-day out in the agreement. So there is a agreement of what services and
I'm not sure how we do that without county approval.
maybe can you ask it in a different way? I'm not.
We have a legal opinion from Corporation Counsel that says we can't enter into a contract as opposed to all of our contracts. We got lots of contracts out there, right? We can't enter into a contract without the county's exec's approval. If we do, then the CEO and the board members are personally liable for that contract rather than the county. That's a problem. So we don't. There's an argument over one particular contract that we think the mental health code may give us some authority over, but this isn't that. Mm-hmm. So I'm trying to figure out how we sign a contract without having it signed by the county exec. And if we need the county exec's signature, will we have it on this, or like we're having discussion now on the finance department? It's an identical situation, except this is one person rather than a whole department. I'm not sure I understand how we get by not having that signature. And if we need that signature, will we get it?
My suggestion is we can wrap back around to legal. I know that the scenario that I'm describing now is something that exists and has been in existence with our psychiatrists for many years, an independent contractor
Well,
agreement.
we have lots of contract employees. I understand that. Not that are, we have contracts with entities, and that we have a rate that's set. I mean, we do lots of that. I understand that. And psychiatrists, we don't have staff contracts. We contract out psychiatric work. But those contracts are co-signed by the county exec. So I just want to know if we're getting ourselves in trouble here.
Nick, Tracy's point is we have never traditionally had the Office of the County Exec countersign any independent contractor agreements. We have other psychiatrists. Some work for America's Back Office. We have a contract with them. I believe that one was signed off on. Mm-hmm. But we have, outside of that, individual independent contractor agreements, and those have never gone anywhere except to at our level.
Yes, and then legal review. The county
The
legal
wording
department
of it.
reviews them for its content.
Yes.
Kathy?
Yeah, point of information, if, I thought I heard you say that before, that if Corporation Council's reviewed it and they're okaying it and they're not sending it through the typical process that we see on other contracts where there's the signature page with, and that's, Nick, that's what you're addressing? It doesn't have that signature page like all the rest? But if, so, gives me an idea. Just don't ask any more questions, okay?
I'm not going to ask any more questions. I'm just going to pass, and then we'll talk about it because it goes to full
No,
board.
I want to understand, I do think it's an unusual circumstance, and I think Dave and I have even tried to work through
Well,
this. So we're happy to answer any questions, so we make sure you feel comfortable with.
Yeah,
route.
there's two levels of concerns I have. One is the one with the county, our relationship
Mm-hmm.
with the county. The other is when we can and can't use independent contractors.
Mm-hmm.
But we can do that offline. I'm just going to pass for today, and we'll figure it out by full board.
Thank you. And I was just going to jump in and say, this is for the approval of the recruitment fee. That's what
Yes.
that's the agenda item. So it's not the entirety of everything else. Any other questions or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Thank you. Next, item 6, receive and file. We have no items to receive and file. Item 7, resolutions. We have 2 resolutions, one for Kathy Charleston from ACT and one from Terry Nakuger from Specialized Children's Family Services. I'll take a motion to approve items A and B. Motion from Selena, support from Megan. Any questions or comments? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next, other agenda items. Start with Megan. We'll go to Linda. We'll let Dave go last. Go ahead, Megan.
I just wanted to, and I'm sure everybody else is feeling the same way, but thank the staff for last Friday for the group home tour we had. It was absolutely amazing. TJ, I know how much work that must have been to set all that up. You and Kendra and Dave, it was so nice. And it was so nice actually spending time with board members too, even though it's been almost a year for us newbies on the board. It was still nice getting to spend that time with everybody, and it was a wonderful experience. Crossroads was amazing. I'm so happy you're here tonight because that was just, look, I'm getting like hot face about it. It was just so emotional and so wonderful. It was just so nice to see everybody be so happy and thriving, and I just really wanted to thank everybody. That was absolutely wonderful. You guys are great.
Thank you, Megan. Linda?
It was terrific. And I think we had just one question that still needs to be answered, that just the number, the comparison between, we saw licensed homes only. And so I still can't get, I need a picture of how many, like we have 300, and of our 300 homes, 170 are licensed and the others are, do the math, are unlicensed. So I just need that number at some point. And then my other point is that I was approached by Nick when I came in. I think he wants to get a date for the legislative while we all have our calendars here.
Friday the 17th?
No.
No.
Actually,
I'm still
Ryan,
looking
knock
for
it
the
off.
year that, I'm still looking for the year that occurs, Nick.
Mr.
Right.
Chairman.
Nick, go
the-
ahead.
The chairman didn't really like us doing round robins, particularly when we're dealing with small groups. You know, doing it at the meetings. But what we've done is because,
How do I override him? No, I'm just-
Vote me out,
take them
please.
outside. What we're doing, and I was just going to announce it so everybody does have adequate notice. We were trying originally to do it by email to survey people, but we're now running out of time because things are moving quickly in Lansing. So we couldn't meet on whatever day we were trying to meet on. And I can't meet this Friday, and we're trying to do it on either a Monday or a Friday because Phil's important to this since he's got a connection to the legislature, and I think it's critical. So we're trying to do it on Mondays and Fridays. So the 17th is the holiday. We've got it scheduled for Friday, this coming Friday, and the agenda's the same, and we'll do the best we can.
I can't come Friday. Which Friday?
A week from Friday.
This
The
is
20
my point.
the
that
21st.
Meeting attendance is very important to me. I hardly ever miss a meeting. And the best way that I do that is by managing my calendar, and we, you know, it like has always worked. But, you know, I'll have a conversation with Phil after why he doesn't like that. But I'm sitting here, my calendar's open. We could pick a date that everybody can go. But If he doesn't want to do that, I can't.
Actually, I'm ready any day next week, but the 21st is a Friday, and that allows Phil to be there, and Phil's
Okay.
important because he works for the legislature, and that gives us
sure.
an added connection, and quite frankly, I don't want to go much further than that, because
Sure.
we're already a month and a half behind, and it seems to me sometimes it's more difficult to schedule a meeting of a smaller number of the board than a full board meeting, but I would prefer that we continue it on the 21st if we're going to have a quorum, and I don't have the list in front of me of who the members of the committee are. Barb, do you?
The members of the committee,
No, thank you.
Nick, Linda, Megan, Ryan, Dana, myself, and Kathy. And the reason why I didn't do it like this time, because you were gone out of town, so I wanted an email sent around so you could be involved in it. That's
But Nick just said that you wouldn't allow that now because you don't like round robin. So that's what I should have known you were just thinking of me, Phil. Thank you.
That's not what you told me, but I'll buy that excuse.
She's here
if
now,
it-
Nick.
Yeah, I recognize Phil's need to get off the hook with Linda. Sure, leave me out there to try. 1, 2, 3, 4, 5, 6, 7, and we need 4 to be there.
I'm very interested in that, but I'm not a voting member right now.
But you can come. You can still come. I mean, any member of the board, obviously, it's an open meeting, and any member of the board, because all we do is make recommendations to the full board anyway. Any member of the board is certainly welcome and can participate at the meeting.
Are you aware that you had Lori Valueway invite the CAC? They need to be informed of the
Right, right. That's standing instructions to Barb when she sends out the notice to include the CAC, along with the usual people who get our postings for whatever this board does.
I forgot to tell you, I went to the meeting the other morning. I went to the meeting there. You weren't there.
Yeah, I
Monday.
sent you 2 emails saying don't come.
All right, I don't care how we do it in the future, whether it's email, round robin, we put a Google whatever calendar thing together, so as long as we get it straightened out. This time I wanted email because you were out of town and I wanted you to be aware and part of the discussion. But going forward, doesn't matter to me. Are you done, Linda?
Well, the email was an arbitrary date already set. You're talking about survey.
No, we
Right.
had.
Arbitrary date set doesn't. I'm not
Linda, we had intended to send out dates by email, and then Barb was off for a while through no fault of her own, and that didn't get done, and then we ran out of time. So we set one up as quickly as we could. Because quite frankly, there are decisions being made in the department that we're not going to be able to weigh in on if we don't meet relatively soon. One's already been done, but it was done right. So
Any other board members before I turn it over to Dave? Ryan?
I just want to say, TJ and Kendra and everyone that planned that group home meeting, that was fantastic. Loved every bit of it, and the clubhouse at the end was just the cherry on top. That really, I think it hit every one of us really deep, and I'd love to do something like that again, maybe in a year or just to see what we're actually doing out in the community, and even other departments, to have some kind of tour. And we just don't know up here when we vote on things. I mean, we know, but there's a difference when you actually visit something versus just reading about it or hearing about it secondhand. So thank you for putting that together.
Thank you, Ryan. Anyone else? Tony?
I just learned today that Peter Lucido, that's our senator, is is pulling together a developmental disabilities town hall meeting. Dave, are you going to talk about that?
I can, yes.
Okay, I just suspect that somehow we're going to be invited to that because,
We're planning it.
okay.
I just found out earlier we're helping to plan it too. Dave? Everybody's a planner today.
We're working together with the Senator Lucido's office. We've been in fairly constant contact since he visited our offices and suggested that. So his office set the date, made the arrangements with the intermediate school district, and then reached out to us to form a panel. So as of today, we have a representative from the Autism Alliance of Michigan. I don't know exactly who that'll be. It might be Dr. Colleen Allen, or it'll be one of her staff. We will have a representative from one of our ABA providers. We will have Janet Mara from our shop, who organizes the autism services. And in discussing this project, it was an autism town hall, is what was said to us. And then the flyer that Phil showed me does say developmental disabilities, but and myself will be there on April 1st at the intermediate school district, and we're working out the remaining details. I did ask Cynthia Robinson from Communications will be our point person going forward, because there was quite a bit of back and forth. So we'll finalize the details with Cynthia and Janet from our side, and Senator Lucido's office. I too wanted to thank TJ and Kendra. That was a very good morning. It was nice to something a little bit different. And I was, I do agree going out to some additional sites. And when you said that, I kind of looked in the back corner there for Sean, but he won't be here till the full board meeting. I'm sure they would love to see some of the board members out there, so we can set up some visits. I don't know if Bruce would want us to come back at a time when he's there. Ray and Josh did such a good job, I did think of you when we went in there. I'm like, oh, Bruce is going to be really upset that he wasn't here for this. But then I wanted to thank Tony and Nick and Lori and Selena. We were all at the Community Mental Health Association conference in Kalamazoo. Enjoyed the time after the conferences and stuff. We had some nice meals together. Interesting. Oh, and yeah, I'm nominated to another. In my free time, I was wondering what I was going to do. I'm like, wow, there's probably another committee or something I could be on. Yeah, thanks, Selena. There was the executive committee, the Monday at 4 o'clock before the conference started. There's a lot of discussion about the system redesign that continues. The association finalized, it was that day or shortly thereafter, their position paper on whether or not on the system redesign, which will help us in our advocacy efforts and keep everybody on the same page. Friday of this week, I'll be in Oakland County meeting with the other 9 PIHP directors. We're going to meet all day to discuss the redesign and brainstorm, and I'll be sure to provide the board an update after that meeting. I put an email out about the CCBHCs, because I know you guys love acronyms, and that's a good long one. That's the Certified Community Behavioral Health centers. The deadline is March 10th, which is approaching way too fast. Jim Losey has been instrumental, and I can't thank him enough. But then he's he had a 2-week vacation planned between now and March 10th. So but he's done a lot of the legwork, and he did a lot of the legwork back in 2016. So we're bringing a lot of that forward, brushing it off, updating it. It's a $2 million grant, and it would definitely help us continue to move, and it would move us faster down the road towards integration with physical health care. The MyCare clinic is signing on with us, and I have some other agencies that they're called direct contracted organizations, or DCOs, in the bid. So I think we'll have a really good submission, and so keep your fingers crossed, and I'll keep you updated. March 10th. Spent some time with our finance department today. We are doing our year-end closeout activities for last fiscal year. So last fiscal year ended September 30th, and it does, on the counties, on the state cycle, it takes until the end of February to get all of that detailed together. So we do have a plan. We're working well. Again, I thank the folks in the finance department. They've been doing a lot of extra work lately, and it looks good. We did submit a updated risk management strategy, an RMS, to the department, and we did receive official notice that they had accepted that. We are projecting to end last year with a surplus that will allow us to put funds into our reserves, or the ISF, and we have an unrestricted fund balance in addition to that, approaching close to $6 million. So it looks to be our best year end in quite some time, and that's the good news. Bad news is the revenue for the current fiscal year is all over the board. The state's working to clean it up, and the word is that this month, around the 24th, we'll get our first clean revenue file from the department. So it only took them 5 months into the fiscal year for us to get an actual idea about what our monthly revenue would be, and we'll be looking at that and making those projections against the budget that we did last year. And again, we'll be updating the board members. Those are the high points.
Stop you before the low points. Any other questions or comments for Dave? Selena?
Barb sent out an email that we have a recipient rights appeal scheduled for Thursday, the 20th at 7:30 in the morning.
Thank you, Selena. Any other comments from board members? Questions for Dave? All right. Oh, Kathy.
I was trying to put that date in my calendar. So that Thursday, February 20th, will be at 7:30, and that's an appeal. I'm wondering if we could schedule a special full board immediately following for purposes of approving CEO contract. Can people stay? Can enough people stay?
At the recipient right.
After recipient rights, which is at 7:30. Typically, the meeting doesn't last longer than an hour at the very most. Okay, and then this meeting probably will only take like 15 minutes. Okay. All right. Good. Then to our clerks, can we make that official then and send the proper notices and everything? Okay. And I'll get the agenda to you. Thank you.
Thank you, Kathy. And I believe we have an authority task force meeting on the 19th as well. Yes, we have a lot of meetings coming up. Do you have the list? I could run through them real quick if anybody needs it. If not, you can grab the list from Barb. Okay. I think I have it. The authority task force is the 19th. Recipient rights is the 20th. Policy and legislative is the 21st. And then full board. Did I miss one? Oh, and the special board meeting. And full board's on the 26th. Okay. Anyone else? Nick?
You've already received the agenda in the past for the Policy and Legislative Committee, but it is going to change just slightly. One of the resolutions, the resolution opposing placing behavioral health under Medicaid, because we have non-Medicaid folks, that seemed a bad idea. The department has agreed not to do that. My understanding is the department's plans at this point are to divide behavioral health into behavioral health and hospitals as a separate unit. This is the way their department is organized. But they had originally talked about putting us under Medicaid, which would have sent some really serious poor messages because we have a significant general fund effort, including jails and prisons. So we won't have to take that amendment up. There's been a renewed on Friday. I had begged out of it because of the group home turn and then ended up not able to go to any of them. For Friday, there was a second meeting of the advocates, and they renewed or rewrote a number of their principles and added some, so I'll make sure everybody gets a copy of that update prior to our meeting.
Thank you, Nick. Tony?
Cynthia Robinson invited folks to a photo shoot on the 19th. We didn't mention that yet. Now, is that for the board members as well as the, okay.
Glamour shots. Laser backgrounds, too.
It was my suggestion, so you can thank me or smack me. We are updating our website, and that will be rolled out. I don't have the exact date yet, but we do want photographs of the leadership, and I thought it would be important as well to have pictures of our board members. So it's optional and voluntary, but if you wish to be pictured, it will be on our website.
So we can do it 19th at the authority meeting?
It's after that. Starts at 10.
Thank you, Tony. I knew I was going to forget one of them. Anyone else? All right, seeing none, we'll move on to hearing of the public. Anybody from the public going once? Nope. Okay. Nobody from the public. Will close the hearing of the public. I'll take a motion to adjourn. Motion from Megan, support from Ryan. All in favor? Aye. All opposed? We are adjourned. Thank you, everyone.